everyone, welcome to Medic Talks with HealthThenMore. Today we'll be speaking with Dr. Chigo Ekeke. He's a cardiothoracic surgeon, and together we'll both ask him some questions. So I'm going to make it a bit different today. I'm not going to ask him all my own questions at a stretch. I'll allow everyone to get a chance. Then if there's no one asking questions, I'll just ask mine all the way. Yes, sent him a request. He's joining us now. Hello, Dr.
Hey.
Chigo. Thank
Hey,
you
how
for
are you?
joining us today. It's a pleasure to have you on this show.
Thanks for having me. I appreciate it.
Yeah, so please, Dr. Chigo, can you tell us more about you?
Yep. So my name is Chigo Ekeke. I was born in Atlanta, Georgia, and my family was born in Nigeria. I'm a third year cardiothoracic surgery resident at the University of Pittsburgh. I went to college at Ohio State University and medical school at Ohio State University. And so now I'm an aspiring cardiothoracic surgeon and living the dream every day. Just got back from the hospital, actually.
Oh, that's nice. Thank you for making time for this program.
No problem.
So, can you tell us, you've told us all about you, then why did you choose cardiothoracic surgery out of all the specialties?
That's a great question. So one of my best friends actually died of a heart attack when I was in high school, around the age of 14, 15 years old. And it was he died from a heart disease that could have been treated with a heart transplant. And so when I started college, I really liked the anatomy of the heart. One of my great mentors, Dr. Capers, is a cardiologist, and he kind of introduced me to getting into the cath lab and seeing cases. And then at that time, I worked with the cardiac surgeons at my hospital, and I just watched them operate. And it was a joy to watch, and I really liked it. They really took me under their wing and allowed me to study them. And I did a couple publications as a medical student with them as well. And since then, I loved the field. And at one time, I learned to like the thoracic side, looking at cancer of the lungs, esophageal disease, and tracheal disease as well. And since this, I fell in love with it. I like surgery as a whole. It's a great field, but CT is my interest specialty.
Okay, that's really great. Tell everyone watching us right now, if you have any question for Dr. Chigo, please type them in, so everyone will get a chance to ask him your questions. I have a list of questions, but I think it's more important for those watching us to ask questions.
Definitely.
So please, everyone, type in your questions. We're going to take them one after the other. All right, Dr. Chigo, my next question is, what was your residency like as a cardiothoracic surgeon? What was it like for you?
Yeah, it's humbling. We work a lot of hours. Here in the States, the cardiothoracic surgery track is two different ways of getting there. You can do the integrated program, which is anywhere from 6 to 7 years, which is what I'm doing. And you have the conventional side, which is general surgery for 5 to 7 years, and then you will specialize in cardiothoracic surgery as a fellowship, which can be anywhere from 2 to 3 years. And so, but in general, residency is tough. You have a lot of hours. You learn how to become a good doctor and a good surgeon. Every year, you get more responsibility, and it becomes a bit difficult as far as your level of management. But it's fun. You touch a lot of people. You're in the hospital a lot, but you operate a lot, and it's really fun. And so you learn how to manage patients. You learn how to work as a team because you're not working with just other doctors. You work with nurses, nurse practitioners, respiratory therapists, doctors from other fields of medicine. So you have to know how to communicate, what's familiar in your field with other folks who are not in the field of CT. We have to work with doctors from other hospitals, insurance companies, and so healthcare is becoming complex every day, and so you learn how to navigate their system as a resident.
Okay. Someone has a question. This kind. What is the best way to memorize medical information?
That's a great question. Unfortunately, not everyone has photographic memory, but you have to just study. I think people don't understand that studying is just like people who play sports. If you want to be ready for a game, you have to practice every day. And so studying becomes not just about sitting down and reading notes, But in my case, is reviewing the cases that you did, seeing what you did wrong, what you could have done better. You always have to keep the books open, because in medicine, the beautiful part is that it changes on a consistent basis. And so you have to keep up with the literature, because different things change. You know, I mean, things have changed dramatically over the past 30 years. And my own mentors have told me that it's been different practicing medicine now than it was back in the 1980s. And so you have to constantly be on top of your game and just reading. You have to make a habit of reading every day, even if it's just for an hour. Whether it's looking at the medications, looking at the type of surgeries. You know, YouTube has been a clutch website, because even now, while I'm not in the operating room or the hospital, you know, I look at videos of different surgeries that take place elsewhere. And so it gives you an idea about what to expect going into a case and what I need to look forward to.
Okay. So when you were in school, did you use mnemonics at all?
Not really. Some things I did, but not really, because I felt like mnemonics was just extra work for me.
Okay.
But I did things with association. So, like, you know, as a third year student, you know, we start on the wards. If I saw a patient who had like pulmonary embolism, I try to remember, okay, how did they present to the hospital? What did we do as a team to work them up diagnostically, and what we do therapeutically? You know, when I go home and read about pulmonary embolism, I can associate what I read with the patient I took care of, so it sticks better for me. So that's how I learned best, is by associating what I saw in the hospital with what I read. Same thing in the OR. If I notice what we use in the OR is different from the reading, I just write down, hey, in the OR, this is what we did, but it allows the steps to stick better, because I can see it in real time and I can read about it.
Okay. So now you've been practicing for a while. What is the innovation in your field that excites you? Any recent innovation?
Right. There's a lot of innovations. That's a great question. Let's see. I think from the thoracic side is more so the treatment. You know, how we're treating lung cancer, how we're treating esophageal cancer. Right now, like, you know, working on looking at different immunotherapies to target different subtypes of cancers. And so I would say that the medications have changed. Chemotherapies have become a lot more innovative. How we give the chemotherapies have been innovative. As far as the cardiac side, I mean, I think the cardiopulmonary bypass machine in itself, which came out a while back, is still the most impressive thing to me to this day. The use of ECMO, the use of transcutaneous aortic valve replacements for high-risk patients who have aortic stenosis. I mean, there's different things every day that are coming out. And sometimes it's tough for me to keep up, because every day, you know, every week there's a journal coming out talking about different cutting-edge technologies. But one of my personal favorites is the robot. So we've been trained to use the robot to learn how to operate, particularly in the chest. And so you sit down on the machine and you work like 4 or 5 arms, and you operate in the chest using a robot. And usually you have an assistant standing by the patient as you navigate in the chest and remove the disease. But I think that's something I really learned to like, because it's cutting edge, it's new, it's still being worked on to this day. It is expensive, but it's pretty cool stuff.
Okay. What's the best piece of advice you've ever received?
That's a great question. You have to pick something that makes you happy, and whether it's surgery, whether it's pediatric, whether it's, you know, women's care, taking care of the elderly. Medicine is a long road. You know, it's not where you just study in school and that's it. You have to study forever. You're a student forever. We take a lot of tests. So I think the biggest piece of advice for me is just staying motivated, staying curious, and not settling for no, because there's always more to learn. And so that's something I've taken with me since I was as a kid. You just stay humble, stay hungry, and stay happy. So the 3 H's: hungry, happy, and hungry, happy, and humble. Yeah, there we go.
Hungry, happy, humble. That's nice. Very good. Now, before you got to this stage in your career, you must have faced some challenges sometimes when you were down. Right. Can you tell us about those challenges and how you handled them?
Yeah, that's a good question. One of my, I guess academically, one of my toughest classes was physics in college. And so in college, I graduated with a biochemistry degree with honors. And one of those toughest courses, one of the physics courses that I took. because I took the physics course with the engineers. The biology students had their own physics course, but I studied biochemistry. We took physics with the engineers, and so it was a lot tougher. And I was never strong at physics. It was my true weakness as a student, and I envy those who were actually good at it. But that was the first time I actually had to get a tutor. I never had a tutor before then. This is my second year of college, and I was did pretty well in my classes, my sciences classes, my math classes. But that was the first time I had to get a tutor, and that was the first time I had to really ask for help. And that's something that you learn very quickly in healthcare, is how to ask for help. And so I got a tutor. I knew how to ask questions. I had to learn how to ask questions in a way where I can get where I need. And so that was like a humbling step for me, is knowing how to ask for help. And so, and I think it started with that class.
Okay, thank you. To anyone watching, please leave your comments. I'm going to read Atta Abraham's comments. Dr. Chigo,
Sure.
as far as applying for clinical rotation, does it help to apply into residency programs where you did your clinical rotations?
Does it help? So, for instance, I went to Ohio State for medical school, and I also applied there for residency. And so, going there as a student, when I applied, I think I was at an advantage because the people knew me already. The staff knew me well. The program director knew me. They knew my work ethic. They knew my resume. So I think there is an advantage to it. I was at Ohio State for 8 years, and so I wanted something different. And so you apply broadly. A lot of my friends, we apply all over the country. 40, 50 programs even. And so when you apply and you interview for residency, you have to find what's the good fit for you, and what best suits your career interest, and who can help you get to where you need to go.
So yes, it helps to apply in those programs where you did
It does. But when you interview at other residency programs, you know that people had different things that you may be looking for, and so you have to just kind of come into it with an open mind.
Okay, and I'd like to know what makes you most proud today. Like one of your.
I would say that my support. I think being a doctor is fun, but there's more to life than just working. And I think my family, my friends, are very supportive of me and my desires to achieve what I want. My parents are very hardworking people. They're also in the States working very hard. I have 3 younger siblings. One's in medical school now. Another's a lawyer. Another one's in his last year of college. And so we just keep each other motivated. But I think my most prized possession and joy is my family and my support.
Oh, that's nice. And what is the most effective daily habit you have?
I would say I keep a list of to-dos for the day, for the week, and for the month. I think that's the most consistent thing that I've adopted over the past couple of years. It's a way for me to stay organized. It's a way for me to have what I call small victories, because in this field it's very, very draining, and it's very easy to be defeated. And so I think it's always important to look for the small victories, even if it's accomplishing a task for the day. And so, every morning, every week, hey, so here's my week, here are my things to do for the week, my meetings, the books I want to read or chapters I want to read. If I can get through these things, I'll feel good about myself, and I feel like I'm making progress. And so I think it's important to just keep an agenda. It's a small thing, but keeping a small agenda just allows you to keep yourself accountable, what the tasks that you do and don't do, and it keeps you organized. And so I think that's something that I've used to make myself a lot more productive and efficient on a day-to-day basis.
Okay. I'm going to read Josh Simmers' question, but before I read the question, when I was making the video for this program, I had to just write a little note, because when I was much, much younger, I thought I was going to be a cardiothoracic surgeon or a neurosurgeon. But oh my God, like, how smart were you to get into this program? Like, you must have been out of this world brilliant. So please tell us, how tough was it to get into the cardiothoracic residency?
Well, thank you. I'm very humbled by by those remarks. It's tough. It's hard. I mean, residency in general, there are more medical schools and residency programs here in the U.S., so it's already tough from that standpoint. I did general surgery for a couple of years before switching to cardiothoracic surgery, and you have thousands of people apply, maybe only 40, 50 interview, and for cardiothoracic surgery, only 2 people get in every year.
Wow.
Yeah, so, in the general surgery here, 77 people get in. Excuse me. So it's difficult. I mean, a lot of it is you have to be prepared. You have to have a good resume. I did research when I was an undergraduate student and doing medical school. I published papers. There are pretty big journals. I got the grades. USMLE is very important. You have to do one of those tests. I have mentors who are very successful and very connected, and so you have to just know how to be around the right people and be normal. I mean, if you know how to interact with people, be courteous, smile, right? Good morning, good afternoon. Those things go a long way, and so I think knowing how to make a good impression and a lasting impression was things that kind of got me by.
Yes, you mentioned USMLE. Like, what were your scores? Yeah. Like, if you don't want to answer, it's okay. But like, how good were they to get you into the program?
I think my score. I won't say the number, but I think my scores are respectable. I didn't get perfect scores on those things, but tests are important. Tests do not determine if you're going to be a good doctor or not. Tests do not determine if you're going to be a good, doctor at all. I mean, that's one thing people have to keep in mind. But tests open and close doors because the people here, the surgeons that I work with, they're the ones who accept the applicants, and they don't have time to go through every single person's application word for word. And so tests is the only way they can kind of weed out people and take who they want. And so it's a competitive field. But test is that letter of introduction. It's like the first page of the chapter. And so you have to get a certain number or score so that folks can continue to be interested in your story. And that's not to say that you have a bad score, you're going to be a bad doctor or a bad surgeon or a bad applicant. It's just, if you're one person overseeing a program and there's 6,000 applicants, you don't have time to read all those applicants. You don't have time to read their stories. So you have to find a system that works for you in your program. And so, but yeah, it's tough, but that's just how it's constructed for the time being.
Okay, I'm going to read Judge Sime's question. How difficult is it for foreign medical graduates to get into surgery residency in the US via USMLE with the whole Trump and migrant issue?
Well, I can't speak on Trump and his immigration policy, but it is tough. That is a natural fact. I have friends who train in Caribbean schools, and it's difficult for them as well. But it is not impossible. I mean, I definitely trained with people who worked in India, people who came from Saudi Arabia, UK. I mean, this isn't, it's not impossible, but you do have to come with a complete package because they compare you to the American graduates, and so that's why it's important for you to knock out the step one score in particular because they correlate with how you do on your board performance. You have to come in with good grades in your rotations. Because it is tough, but it is not impossible. Okay. It's been done several times.
All right. Atta Abraham said, what advice do you have for those planning to apply to cardiothoracic surgery and are currently doing their clinical rotation?
So that's a great question. So like I mentioned before, there's multiple ways to get into cardiothoracic surgery. One way is to do general surgery for 5 to 7 years at any program here in the U.S., and then you can specialize shortly after. Cardiothoracic surgery is a very focused field, and so having exposed to different types of surgery I think is important. Pediatric surgery, transplant surgery, vascular surgery, urological surgery, neurosurgery, orthopedics. I mean, there's different types of fields, and so it's important to kind of put your hands in different things and see what's out there. And as a student, you as a resident as well, before you say, hey, I want to do cardiothoracic surgery for the rest of my career. So that's what I would recommend as far as going that route. But it's like I said, it's possible. You just got to work hard, study hard, and sometimes do research. I had people who went to med school overseas. They came here to the U.S. and did research with like a big institution, and they just worked with the cardiothoracic guys closely, and they took the test and did well, and they got a position. And so it does happen.
Okay. And Zain Ali 4547 said enoxaparin sodium, how to use?
Lovenox, we use it all the time. I mean, we give it subcutaneous shots. We do it all the time in the hospital. It helps. I'm not sure what the question is asking, but we use Lovenox all the time, or enoxaparin sodium.
All right. And Doodle Bet said, Do you have plans to start a clinic in Nigeria?
Me and my parents and my family all back home, we talk about doing big things in Nigeria. One thing my parents make a big my parents make a big point that you can never forget where you come from. And so the last time I was in Nigeria was 2011, 2012, and I still have a lot of family there, and I love it. And so I do have plans to go back home and get back and hopefully teach people how to do the trade. So I'm not making any promises yet because you have to see me when I get there. So you'll see.
All right. Atta Abraham is asking, what would be considered a good step 1 score?
I think a strong step 1 score now, I'll say above 245, 240.
Oh.
Really good is like above 260. Wow. That's just for like the cardiothoracic surgeries and the special surgeries. In general, people usually get to residency with above 220. Whether it's in family medicine, pediatrics, or internal medicine. So it depends.
Okay. All right. There are no more questions. If anyone has any question, please quickly type them in. We'll be saying goodbye to Dr. Chigo very soon. So just type them in so we can ask him. And for me, let me see if I've gone through all my questions. Okay. So Dr. Chigo, you've told us about your daily habit, how you keep yourself, your effective daily habit. So what about day-to-day? How do you keep yourself motivated? Especially when you have something great you want to do, how do you stop yourself from getting discouraged?
That's a good question. I think it really leans me on the support. I have a very loving family. My fiance, she's very motivational. We support each other. My brothers keep me going. I know for me personally, everyone has different things that motivate them. And for me, it's like my family, people back home, and of course, people back home praying for me and wishing for my success. And I have mentors who have a high expectation for me. And so, a lot of it is, if you have people who expect much from you, you got to deliver. And I think nothing's worse than disappointing people who are really cheering for you. And so, for me, it's that sense of pride that I want to be the best that keeps me going every day. And so, I read incessantly. Even when I'm sleepy, I'm reading. If I take a nap, I wake up 2:30 in the morning, I pop a book, read for 30 minutes, go back to bed again. And so, you just gotta be hungry. You have to really want it. You have to want to be the best, and it's tough to do that if you're sleeping all day. So now, mind you, you do have to balance yourself. There's a time to play and a time to work, and so making time to enjoy yourself is important as well. So I do take vacations. I definitely want to put the books down and have a good time. And then when it's time to get back to work, I get back to work again. So,
wow, you sound like a genius. Like God, you read so much. You really
yeah. I wouldn't say I'm a genius, but I try to work hard.
You are. So, Masig222 is saying, what is a good step 2 score?
Yeah, I think step 2 score are about the same. Usually, the step 2 score is expected to be a bit higher. Step 1 test tends to be the most difficult test. Of all exams, and talking to the guys who've been training, everyone says step 1 is the toughest exam. So step 2 score usually expected to be a lot higher because I think it's an easier test. We take the clinical skills, which is a pass fail, and the clinical knowledge, which is a scored test. But most folks care about the step 1, but that doesn't mean you shouldn't do well on step 2. But many people take it at different times of the year, so that it's not weighed as much as a step 1 score.
Wow.
But again, it's important to know that the exams are important, but you also have to have a good application resume because, again, if other people are applying to a field and all have good scores and good grades, there are other ways that programs pick them. Letter of recommendations. So you have to do well in your clinical rotations. You have to be well read. You need to be participating on rounds, learning about your patients, asking for feedback because you want people to write strong letters of support for you when you apply for residency. So that makes a very big deal because that's what matters. If you have a great score on step 1, but you don't do well in your clinical rotations, it's tough to get in. So,
all right, Dr. Eni Ola says, any advice for international medical graduates?
Yes, my biggest advice is do well on step 1. If you do well on step 1, it gets you in the door for interviews. It's very difficult to really navigate this space if that exam was not up to par. It's just very challenging. Not impossible, but very, very challenging. I've had friends who've interviewed for multiple years had not matched because they fell short of that exam. And so it's important to have, do well on that exam, and it's important to have backups. Hey, if I'm not competitive for cardiothoracic surgery, is there another surgical field I can do? There's other fields of medicine that you can do procedures and not just surgery. And so those are things you have to consider. Like I said, nothing's impossible. You have to just you have to just work your butt off.
All right. Vexolo is asking, what would be your recommendation for management of doctors' arteriosus in babies?
Oh man, I think that's outside the scope of this video interview. But there are books out there about managing patent ductus arteriosus in babies, and so I don't do congenital, but we do. I will do a congenital rotation later on in my residency, but there's thousands of books on managing those kinds of patients.
Okay.
So I can't say I don't have any recommendations on record, but the literature's out there.
All right. Masig 222, is a 2-year gap a big deal while applying to residency?
No, it isn't. It isn't. Some people use that 2-year gap after medical school to get stronger. Some people do research for 2 years and get published. Some people get additional degrees, and so it is not a big deal at all to do that. You have to just be productive and show folks that, hey, while I was not in school or while I was in med school, because you can be in med school and take 2 years in between med school studies, you have to just tell people, hey, while I was in med school, those 2 years off, I got another degree, I got research done, I got published, I was doing a lot of different things. I wasn't just staying at home watching television and getting dumb. So we have to really prove that and put that on paper.
It's Kirantistic. Hey, I'm from Pakistan. I want to know how to manage time.
If I knew the answer to that, I'll be the real genius. Time is never enough. I mean, you have to keep that reality in mind. You never have enough time. But like I mentioned before, if you didn't hear this segment of the interview, I keep an agenda. And that's something I recently adopted because my days get so hectic. It's easy to miss appointments, deadlines, because you're always on the go. My day starts sometimes 4 o'clock, 4:30 in the morning, and ends at 11 o'clock at night, midnight sometimes. That's just being in the hospital all day, and you still have to come home and wash your dishes, right? Wash your clothes, find dinner to eat, call your friends, call your family, breathe, work on papers, and so you have to just really put down, hey, what are these goals I want to set for the day and for the week? What's possible? What I can and can't do? And you're going to be efficient. What takes you 2 hours shouldn't take you 2 hours next week. It should take you less than that. And so that's just the best way, I think, to manage your time, is to have it written down and what you want to accomplish for the day.
Okay. We'll take this last question from Answer Momana. How would you be a good cardiothoracic surgeon?
So how would I be a good cardiothoracic surgeon? Attention to detail, learn how to operate, being a good doctor, just knowing how to have good patient care, doctor-patient relationship, showing empathy, learn how to work well with the team is very important because the surgeries are very big and you have to have good communication skills and good leadership skills, keeping a very cool and collective head in the time of turmoil or stress. Sometimes the surgeries don't work out very well. Sometimes the complications, and you have to know how to, learn from those things and move on. And I'm still learning that myself. We're taught to be perfectionists, and so sometimes it comes at the expense of pride and be able to see beyond failure sometimes. And so, you have to just really, really know how to humble yourself, look beyond your failures and learn from everything, every small thing. Learn how to work well with everyone, from the big person to the little person, because everyone is a part of a team and everyone has something to contribute. And so if you have an attitude in which you feel like you can learn from anybody and everybody, you will do well. And so, again, always read. Any small thing, pick it up, read it, stay on top of the literature.
Yes. Thank you so much, Dr. Chigo, for making time from your busy schedule for this. I know we're going to upload the video on YouTube later for other people, so it's going to be up for years for those that want to be inspired by your story. It's not every day we come across a cardiothoracic surgeon from Nigeria, so we're very, very happy that you took your time to do this with us. Thank you for staying humble, because you only a humble person can do what you're doing with us today. So thank you so much for doing that. Can you please just say those 3 H you told us about in the beginning? Hungry, humble, and...
So hungry, humble, and happy.
Happy. Okay.
Yeah, you gotta be happy. If you don't like what you're doing, it's not worth doing. But yeah, work hard, guys. I'm still going through my residency, and so I learn every day, and it's my pleasure to be of service, and I hope someone got some good advice from this video.
Yes, they are definitely going to, because I'm going to upload it on YouTube. So thank you so much, Dr. Chigo.
Right.
I'll send the link. I'm so grateful for this opportunity, and we all are, on behalf of everyone watching.
No, the pleasure's mine.
All right, take care until another time we need you. Thank you so much. All right, bye.
Mm-hmm.